I am Yona Lunsky from the Azrieli Center here at CAMH, and I'm excited to be back with one of my favorite family doctors, Ullanda and Niel. You want to introduce
Hi.
yourself?
Hi, I'm Ullanda and Niel. I'm a family doctor. I see patients with intellectual disabilities at my community health center in Scarborough and also at Participation House in Markham. And I'm happy to be here.
Yeah, this is
This
our
is my third time doing this. So I'm rolling through the season. So now I'm trying to get a little more of a fall motif.
yes. Yes, we need to have like some autumn leaves behind us, But it is an important time for us to be coming back, I think, to some questions that might be the same questions, although the science and the information we have now is a little different, as well as some new emerging questions, I think, as we have our emerging Delta and our, emerging very vaccinated population, things opening back up, what it means, all kinds of issues, I think, that people with disabilities and families want to know about. So I'll interview you, but sometimes you can interview me, and let's interrupt each other as we go and try to get to the bottom of some tricky questions for people. We got some really good questions from different people with disabilities, about COVID, and I thought it would be good if we could take a few moments to answer some of those questions. So, a lot of people have already had 2 doses of the vaccine, which is great. One question that's come up is, do I need another shot? Do I need a third vaccine?
So right now, the answer is we don't know. There's only going to be a small group of people right now who need to have a third vaccine. People who have trouble fighting infection and have problems with their immune system. And so you would know, your doctor would tell you if you needed to have that additional shot. In the future, it might be that certain people will have to have an extra vaccine, but we don't know yet. I think when we first started to put out the vaccine, we thought that people might need to have those booster shots, but we just don't know how often or how many shots we're going to have to do just yet.
Yeah, it's kind of like the flu shot is something we don't get just once, right? It's something that we get every year. It may
And
be
that was the thought, yeah, that it was going to be kind of like the flu shot, maybe. Yeah.
Yeah. So at some point, we will be looking at people getting another kind of shot, but not yet.
Mm-hmm.
And, I think some people thought after everyone got vaccinated, maybe the pandemic would end. And here we are, still saying that we should wear our masks when we go inside, still saying, to be careful, not to have so many people together. When is this going to end? Do you know?
Right. I mean, last spring we were saying, okay, everyone's got their shot. We're going to go back to normal, but it's not working like that, right? And there are a lot of reasons that we're not able to do that. But one thing that we do know is that if you have your vaccine, you have a lot of protection. So that's very good. And if we want to be even more protected, then we can do some of the things that we've learned over the past year. For example, wearing a mask when we're inside, especially when we're around people that are not part of our house, or avoiding really big gatherings, especially if you're not wearing a mask, right? So we can do some things to make things safer for ourselves. But we've also learned that it's really hard to stay apart from people, right? And to be on a lockdown, for example. And so I think we're going to try to use that only when we absolutely have to.
So I know right now, like people have been saying it's good to be outside and not inside. If someone's had both vaccines, it's going to get colder. Right now it's pretty nice outside, but it's going to get pretty cold in November, December. Would it be safe if someone had their vaccines? Can they go to their friend's house and would that be allowed to go inside, or is that not safe?
So there are some things that we can think about to decide whether it's safe or not. One is, have you had your vaccine? Has your friend had their vaccine, and maybe the other people in their house? and how long will you spend inside together, and maybe what is the airflow in that area. So could you maybe stay in a room that has an open window? Do they have really good air heating, or are we in a very closed space? Because you can make it a little bit safer if you stay around people who've already had their vaccine. And you can make it even more safer if you're able to wear your mask when you're inside.
Right. So maybe three things then. So being with people who've also had their vaccines and you've had both vaccines, having that window open, even if you have to wear your coat inside a little bit or you're a bit cold, and having a mask on. And do you think some masks are better than other masks? Should people be wearing the masks that they wear in the hospitals, the blue masks that they throw out, or is it okay to have material?
Those are good. Those are fine. You can wear the blue mask. You can also wear cloth masks, but it has to have enough layers. So you can check your cloth mask to see, does it have 2 layers, like one layer on the outside, and then another layer of cloth on the inside, and something in the middle, like this interfacing. There are also some that have like a filter that goes in here, but you have to take that out when you wash it, and you can only use it so many times. So these ones are really nice because then they have everything's all built in, and when you wash it, you can just use it again.
Yeah, getting a mask that you like is important. It isn't, it's got to fit you right. It's got to have the right
and feel
layers.
comfortable, right?
Yeah.
Like you can't, I find there's some masks I like it, and then other ones I put them on, and when I'm talking, it's always falling off, or it just doesn't feel right.
Yeah.
So, you know.
Yeah, you got to feel like it's staying on well, right? Including covering your nose, not just your mouth. So
yeah, and we all look like everybody's face shape is a little bit different.
yeah.
So not everyone can wear the same mask and feel comfortable.
It's almost like having a mask fashion show where you kind of try on, and this is important, right? Before you go out, you got to wear the mask for a while. So don't just wear it for 2 minutes, because they all stay on your face for the first 30 seconds. You got to wear it, talk, move around.
Talking, see what happens.
Yeah, absolutely. Thank you so much, Dr. Niel, for talking with us today and giving us your wisdom. And I'm sure we're going to ask you questions again.
Hey, no problem. I'm happy to do it.
Okay, take care.